Hey everyone, thank you so much for joining the Behind Company Lines podcast. Today we have Dave Jacobs, co-founder and co-CEO of Homethrive, a fast-growing tech-enabled healthcare service company that's disrupting and revolutionizing how organizations support unpaid family caregivers and their loved ones. Dave, thank you so much for joining the show. I'm really excited. I mentioned before the show to dive into your background, your experience, but also, working within working technology within a space that has a lot of legacy technologies and maybe have some slower red tape that you have to go through. So always fascinated within startups who have to kind of, work on other people's timelines, so to say, and kind of have experience building kind of a really a product that's going to affect people in their day-to-day lives rather than, nice to have. I feel like a lot of companies in your space are need to have products that solve a very particular and important problem. But before we get into all that, what were you doing before you started Homethrive?
Well, I'm thrilled to be here, Julian. Thank you very much for having me. I've listened to the podcast, and it's really interesting to hear entrepreneurs talk about kind of the challenges and experiences they have in kind of getting business started. So happy to be a part of it. And before my partner and I started Homethrive, we were both senior executives of a large healthcare company called Medline, about a $20 billion manufacturer distributor of medical products to all segments of healthcare, from acute care to skilled nursing, home care, retail, you name it.
Yeah. What was like that experience, founders who come from a large organization, what are some things that they do well, or maybe some things that they might not do well that you've taken in the lessons you've taken onto building your own company? Anything in particular kind of stand out to you?
Yeah, it's interesting. And it's a combination of both. I think the things that we've learned to do well in terms of managing larger organizations, hiring people has kind of certainly been a part of it, creating the right incentives and working on the culture. Although there's a lot of differences between a large company and a small company. The speed at which even Medline, which is a very entrepreneurial, privately held large company, the speed is very different, and the agility than an early stage business. So I think that's very different. Even the way you hire and the kind of skills that are needed. There's not only the functional skills, but there's also the kind of the ability to live with more ambiguity than you'd find in a large organization, and the need and comfort kind of pivoting very quickly than you'd find in a large organization as well.
Yeah. What were some things that you've seen in your experience in healthcare? I think the healthcare is always such a hot topic. We have politics running for office, and it's always kind of part of their message and what they're trying to do. And it's always around access. And where do you think the biggest gaps in access are in healthcare that we see on different levels and different people, in different healthcare circumstances? I feel like, someone's physical health and mental health is on such a big spectrum. It's hard to cover all bases. Where is the access difficult, and what are the biggest gaps in giving everyone, a standard or maybe a unique sense of access to their needs?
Yeah, it's interesting, and it's a real challenge because unfortunately our healthcare system is so complicated that sometimes there is just kind of pure availability of services, which people are kind of challenged with. But probably more often than not, it's really understanding where the services are available and how to access them and how to get them paid for, even if many times they are. Is that kind of, even for me in my own personal life, navigating kind of the system of which doctors and specialists to go for which different things, how to get certain tests done and covered by insurance is really challenging. I've had some tests done that certainly were not for my pleasure, but we felt like we're good to be able to identify and maybe prevent kind of a bigger health issue down the line. And it was a challenge to get those things covered by insurance process. And people who have really, I'm fortunate to be very healthy, but people who really have health challenges right now really struggle to get access, not only to kind of medical procedures and things, but a lot of the social determinant related things that are critical to health, which is access to good nutrition. It could be access to engagement things to reduce isolation and loneliness is a real big challenge in the world we're in terms of caregiving support. Being able to give people access to the kind of services and products that people need to be able to live at home, kind of healthy and happy for as long as possible is a real challenge to be able to figure that out.
Yeah. What are some main causes to that complexity?
It's a it's a good question. I think there's a variety of things. I think some is things are very siloed within healthcare. And so, like you have certain medical care that is separate from other kind of social determinant related things and community-based organizations. They're not usually part of the same overall organization. I think the way in which these things are paid for is very siloed and complex and hard to kind of unfurl as to who qualifies and who doesn't qualify kind of in the
Yeah.
process. And, there is also the reimbursement function,
Yeah.
whereas, physicians aren't necessarily reimbursed to kind of help their patients get access to community-based organizations that will reduce isolation and loneliness and things, which are real contributors to people's overall well-being and health. But because there's
Mhm.
not a reimbursement code for a physician, it's not necessarily prescribed or kind of focused on very much.
Yeah. What are some ways, that I guess things can kind of adapt or evolve into realigning the incentives? Because it seems like, you mentioned there's not a particular code a physician can have to, benefit from giving someone a referral or access to a community-based service that's actually beneficial in a lot of different ways. What are ways, I guess, is it governmentally? Is it locally? Is it within private organizations, nonprofits? Who's working on realigning the incentives to helping people, give, I guess, take the extra step in helping someone realign and get access to the care that they need?
There's a lot of organizations that are working on it. From my perspective, the one of the most valuable initiatives overall is where you have kind of organizations that are taking full risk for
Mm,
individuals, and then they're given
mhm.
kind of a whole sum of money depending on the condition and risk
Yeah,
adjustment of those individuals, and then they can invest the money wherever they see fit for those people.
yeah,
It certainly can be in medical care, which is critical, but you have
yeah,
organizations that are also providing housing for people. They're providing meals. They're providing services like Homethrive, where we kind of support the family caregivers who are a force multiplier for these
yeah.
individuals, even though there may not be a billing code associated with it. They know it's not only right for their kind of the person they're insuring, but it's also going to lead to better outcomes and greater health over time.
Yeah. I was looking at your background and it wasn't necessarily healthcare focused coming into the gate, but what I guess piqued your interest or inspired you to work within healthcare and then now start a company that is very much supporting an underrepresented, component of people's healthcare at the end of their life, not during kind of the main cycles as most of the, money is made, quote unquote. But now it's mainly on the latter end of someone's
Yeah.
experience. What got you into this whole healthcare industry?
I started in healthcare now about 20 years ago, more because I was interested in the company. And I thought
Mm,
that the combination of a really well-resourced, well-established company like Medline with the entrepreneurial spirit and opportunities that would create would be really interesting. And healthcare is a very dynamic field that has a lot of growth potential. So that's why I joined. It was probably more fortunate than, kind of strategic on my part. But what really kind of got me in and my partner to start Homethrive was our own personal experience. We were the healthcare executives. Frankly, we had pretty cushy jobs,
yeah.
doing really well. But then I had a personal experience with my dad got really sick really quickly. He wanted to be at home with my mom in Connecticut, where I grew up. I was in Chicago. My brother's in Chicago. And despite knowing a lot about healthcare, having a close family, having the
Mm,
means to support our parents, it was incredibly difficult when my dad got really sick.
yeah.
And, all the stressors that you hear about, I kind of went through. I gained 20 pounds in about 6 weeks. I was flying between Chicago and Connecticut. It put a strain on my nuclear family. I even thought about taking a leave of absence to try to kind of get a handle on all of these things. Family issues that kind of live beneath the surface start to percolate up. And when we got through this, I thought to myself, this shouldn't be so hard. And I'm fortunate to have a lot of resources. What does everybody else do? And you come to find out that regardless of your education, experience, family situation, it's incredibly difficult and complicated for people. And my co-founder, David Greenberg, had a similar experience. And we decided to leave those cushy jobs to really solve this issue
Yeah.
in partnership with Seven Wire Ventures, to reduce that work worry and stress for family members so they can be there for their family and they can be there for their career and they can be there for the long term. Because we don't think it has to
Yeah.
be a choice between your supporting your parents or family members' special needs or being there for your career. You should be able to do both and bring your whole self to work. And that's really what we've been committed to for the last 3.5 years.
Yeah. Were you working on this product while working at, Medline, or did you just kind of, what was the catalyst for taking the leap and fully investing the time and attention into building Homethrive?
The catalyst was my own experience, but you
Sure.
raise a good question, which is it's one thing to have that it's experience, another thing to take the leap. And for me, it was a combination of this experience and wanting to do something that was more mission driven. But I'll be honest too, I thought to myself, I was turning 50. I was taking a walk with my wife and we had talked about this. And she said, well, if you stayed at Medline, which I like very much, how would you feel in 10 years versus going to do this? And I felt like if I had stayed at Medline, I would have been taking the safer way out and not challenging myself as much and not really reaching for something that was less certain, but something that I could be really passionate about and would be incredibly challenging and fulfilling. And I decided I didn't want to get to be 60 and feel like I took the easy way out. I wanted to challenge myself. And I decided, even if it meant, there's no guarantee of success, certainly in an early stage business, but it was worth the risk. And the opportunity to make an impact on people was certainly worth it to take that chance. And, my daughter, who's 19 now, asked probably the toughest questions at the time. And she said, well, what happens if it doesn't work? And I said, I'll get another job. And, I felt like there's always kind of another opportunity, but, fortunately this has worked well and we're very committed to making a real big impact.
Yeah. How do you always kind of have this entrepreneurial spirit? You mentioned that a few times with why you joined Medline. And you kind of, it seems like it was definitely much almost like a value or belief system that really kind of guided you there and now in Homethrive. But do you think you had that in you and it was just kind of timing?
Yeah, I've done, even when I was a kid, I would ask my mom for extra Twinkies and Ho-Hos and I would sell them to the kids whose parents wouldn't give them that stuff. And then in college, I started a couple of different businesses. Out of college, I worked at Quaker Oats and then I started my own business and did that for a while and then started another business with a partner. So I've done entrepreneurial things and I love the creativity and the challenge and the feeling of impact. And then I was at Medline probably for longer than I even thought I would be because I did enjoy it. But I always kind of had a desire to get back to that kind of even more entrepreneurial kind of situation. So I've kind of had it for better or for worse in my blood for a long time.
I love that. How many years did it take you to kind of get traction and kind of define your product and define the product market fit? I think a lot of founders, either they hit it right off the bat because they see exactly what's needed, but others, it takes time to develop the right technology, right solution based on the particular experience. We talked about before the episode, a lot of red tape, especially within healthcare in particular. And there's a lot of, regulations, the things that you have to abide by. But how many years did it take you to get traction? And what was like the biggest significant milestone that launched you into where you are now, or it continues to move you forward?
Yeah. Yeah, no, it's a question that kind of founders think about and talk about a lot to each other, but and then to other founders. For those who can get it right out of the bat, God bless them. It's fantastic, but it's really challenging. It probably took us, we were in this general space when we started, but it probably took us a year and a half, 2 years to get more clarity on really what the value proposition was, what the differentiation would be. And it was progress. So it's not kind of a lightning bolt moment, but it was progress over time and being in front of customers and getting told no or learning kind of the hard way quite a bit. I think the thing though, that really, there are a couple of things that kind of catalyzed for us probably a year and a half ago. One was, we saw that we were serving both older adults and family caregivers, and we really saw the gap and the need was around the family caregivers in particular, that the healthcare system didn't do a lot to support them. They recognized the importance, but they weren't doing a lot because in some cases they weren't the one that somebody was insuring. And on the employer side, where we do a lot of work as well, employers recognized that they had family caregivers, but most people suffer in silence and they didn't have a program. And so they weren't spending money against that. So we recognized that we really saw an opportunity to go kind of much more focused on the family caregiver. But our challenge was, how do you do this in a way that scales and can be cost effective? We started off with our own team of social workers who are absolutely fantastic. They're all experienced in working with families, older adults, and families with special needs, but that doesn't scale and it's expensive over time. And then the other thing we started to realize is not everybody wants to talk to a social worker, even if they're great and they're trusted all the time. They only really want to talk to them when they're in kind of the most intense situation. So we said, how do we take that empathy, personalization, and expertise that our care guides, that's what we call our social workers, have, and put it in the palm of somebody's hand? And that process, when we kind of really focused on that challenge, we came together as a team. And about 15 months ago, we launched, after about 6 months of work, we launched our digital caregiving assistant that really goes in companion and tandem with kind of the high touch service that gave us the opportunity to really reach a lot more people, to do it at a lower cost and to give ourselves the opportunity to reach really large healthcare organizations like Medicare Advantage plans and Medicare supplement plans, and with a much lower cost offering that's really effective that we couldn't have done only
Yeah.
with kind of our live kind of social workers.
Yeah. How many family caregivers are there? And do you have a specific number in the world that, but to share kind of the brevity of the necessity to serve the community?
In the US, there's about 53 million unpaid family caregivers, and that number is growing by 10 to 15% a year as people, not only they get older and they turn 65, but less and less they want to be in senior living communities. So they're going to be home, they're living longer, and it creates a lot of challenges for family members. Um, and,
Yeah.
and family members most often, I should say, often they're not living in the same community with their parents, and they have their own careers and they have their own nuclear family. And so it's an increasingly big challenge for everybody.
Yeah. Yeah. What are the most common resources that are offered to these caregivers that ease the, I don't want to say burden, but ease the responsibility that they internally feel towards, assisting their loved one kind of go in this later transition of their life?
Well, that's the challenge, is that there aren't a lot of readily available resources for family caregivers. The two things
Yeah.
that people do the most is they go to Google, which is great, but it doesn't really, you have to know what you're looking for and you have to sift through so much stuff, and people don't know what they're looking at and what they're looking for, or they go to friends. But the two things we hear the most is, I don't know what I don't know, and I don't know what I'm looking for. And I need somebody to be a guide for me to help me understand, what are the questions I should be asking? What comes next?
Yeah.
And how do I think about these really challenging decisions that I have to make? All the different considerations. What are some of the experiences of others? And that's really kind of the resources and the assistance that we provide, is guiding them in that journey about kind of what comes next, how to think about these different issues, what are their different options, so that they can
Mhm.
make the best decisions for them and their families.
Yeah. What were some of the challenges you faced building in a technology? I'm assuming you send the technology is in the palm of your hand. I'm
Yeah.
assuming a mobile application. It's probably, accessible for both app stores. What are some of the challenges building an application that is so, the access to data and resources is still extremely vast? How do you simplify that and offer it in a way that's easily digestible? And what were some challenges that you faced as a founder that, came from not necessarily a software and application background, but, kind of seeing it from a different focal point of perspective to utilize technology to give this access?
Yeah, no, it's been a big challenge. It's something we think about a lot. You're absolutely right in terms of that being a critical issue. So there are a few things. One is, how do we take the experience that people like so much with a person and give them 80 to 85% of that value and that experience in a digital app? It's not going to be 100%. It's not, but we still wanted to make sure it had personalization, had empathy,
Yeah.
and it had the right balance. You hit the nail on the head. People, one of the problems with Google is you get overwhelming amount of information. Some of it is too short. Most of it is just too long. You don't need a New England Journal of Medicine article or study to be able to help you. So how do you
Yeah.
get people the right information and also give them kind of the guidance, be able to personalize the experience for every individual, but also
Yeah.
take advantage of, what is gone on over the years. And there's a lot of commonalities. So we're able to find that right balance is really challenging. How do you also integrate the live kind of high touch component for the right moments? Because it does play a role when there's a new diagnosis, there's a fall, there's a decision around where can somebody live? Can they live at home? You do need a live person. How do you find that right balance between things for people?
Yeah.
Was a big challenge. And then how do you make it easy for people to navigate and use? And understand that those are the things that have been a challenge, and we continue to think about. How do we make this thing easier and more helpful? And then even from a resource standpoint, how do you customize? Some people have access to resources that are paid for, other people don't. How do you kind of find ways to get people the best local resources and do that kind of on a national scale, which is what we do?
Yeah. I recently read that you had a big successful fundraising round earlier this year, and I'm sure that kind of propelled you to not only reinvest in technology, but also kind of scale on multiple sides of your business. What was the fundraising process like in regards to fundraising in a healthcare space and a technology that's new? And as a founder that, for better or worse, didn't have the previous pedigree that a lot of founders have in pretty much starting from scratch, right? And in a lot of ways, and communicating that value prop. It's not that you don't know business in and out, but in this particular space, it's gaining that trust to know your product, know your market, and build that forward. What was that evolution like for you?
Well, it's interesting. One of the things that's exciting and great and a challenge for what we're doing is we're really kind of in a leadership position to create a market.
Yeah.
People understand the needs of family caregivers, especially if they've gone through it, but it's not in the employer space. An increasing number of employers are offering caregiver support as part of their strategy around physical health and mental health and whole person kind of health, but many companies don't. So you have to educate, you have to help them find budget. You have to educate them about the need for this and the priority of this. So that's a challenge. On the health plan side, you have a similar kind of challenge where people recognize it, but it feels like a little bit of a leap for them because the family caregivers are not the ones that they're insuring. They're insuring their parents. And so how do you show them that actually investing something in the family caregivers will pay dividends for the people that they insure and whose satisfaction and retention they really want, and whose costs and healthcare outcomes, costs they want to go down and outcomes they want to go up. So that's also part of the conversation with investors, which is, it's great that you're creating this market, but how long will it take? And how do we get confidence that it will develop the way that you guys believe it will? So, we've had to work over time. Working with investors is like other kind of organizations. You have to get to know them. You have to build trust both ways. And also you have to find the ones that share a similar vision, just like not every prospect is the right one out of the gate. What we found is there are some investment firms, and fortunately there's more than a few, who really see aging in place as one of the big strategies that's coming up. And they also recognize that family caregivers are going to be a big part of that, but also have a lot of need themselves and that there's a market there. But they have to recognize that it will take a little while to develop that market. So we're working very hard to be able to do that, to evangelize the need for that over time, and then be able to kind of capitalize on those opportunities. So.
Yeah. What's, if you were talking to either your former self before you started Homethrive and took the leap, or anyone who's looking to start their own company and kind of, navigate the startup, it's like a lifestyle, I would say. What advice did you give them? What kind of knowledge do you wish you would have had earlier than that you would instill on someone now?
I was, given the amount of experience I've had, I was aware of this, but I remind myself every day that we're on a mission that's really important, and it's going to be hard. And within the scope of any given day, there are some really wonderful highs and there's some big challenges. And that's what I've signed up for. And it's not kind of a middle of the road kind of experience. And that going through these challenges is what founders kind of experience. Building teams is at a rapid pace and kind of with changing needs is something that founders experience. And that the highs and lows are part of the journey. And it's important also to take care of yourself along the way, because we've been at this actually almost 4 years, and we intend to be at it for quite a while to come to build this business. And you got to be in it for the long haul, and you can't, you got to make sure that the highs aren't too high and you don't get too low, and you really keep your energy and outlook at a very even keel so that you have the energy all day long, kind of week in and week out, which is challenging kind of with an early stage business where you can always do more and you want to throw yourself into it in a tremendous way. And the other thing I focus on a lot is kind of the idea of, I focus on what can I control now. And you realize when you do that, there's a lot of things you can control. You can't control necessarily how quickly customers adopt the program. You can control kind of the different ways that you evangelize and different ways you think about things, control the energy you put into bringing on a great team and colleagues, and doing things like that, make sure they're well equipped and trained and things of that nature. But there's a lot of things that are out of your control, and trying not to get too worked up about them and just focus what you can control, I find to be very helpful.
Yeah. What's the most gratifying thing that you get out of running Homethrive?
I think two things. We work with some fantastic people who are incredibly passionate and curious and smart. And, just today I was on with our head of product, and he was just talking about some of the data that he was looking at, because he was curious about patterns where people hadn't engaged with us in 2 months and they come back, and what are the common characteristics. And that kind of curiosity and energy is just incredibly refreshing. But honestly, the most thing, and this is a little surprising to me, I knew this would be something that would be very gratifying to do. But to see and hear about the people that we impact and touch on a daily basis really makes an impact. It doesn't matter what their education is, of what their experience is. I mean, people go through this in a very profound way, and to know we're making an impact is really gratifying. And it sounds trite to say that. And I know you probably, for good reason, get a lot of people to do that, but it's more than I thought it would be. And so every 2 weeks, we have an all hands meeting, and our care guides will share some of these stories. And you realize we're meeting people at usually times of very significant need and challenge in their life. And the fact that we can be a source of support and guidance and help is very gratifying. And our goal is to be able to do that for a lot more people over time to make a bigger impact.
Yeah, I love that. Tell us a little bit about the traction. How many people are using your product? How many family caregivers are using your product? Where is, are you building partnerships with other companies or groups and organizations? Tell us about all that good stuff that gets you excited and the growth that you're having, not only this year, but your projected growth as well.
Yeah. So, we think about traction in a few different ways. We've got about over 100 national companies that are using Homethrive, that have adopted it. Some of the ones that are kind of more progressive as they think about health and well-being and retention of productivity. Everybody from kind of professional services from Latham and Watkins, one of the leading law firms in the world, and Perkins Coie, but also large employers who are very progressive, like in Ecolab, that's using it. So we've got a lot of employers that are using it. And then we also have a good number of health plans that are kind of using our program and having success with it. So everybody from Cigna and Blue Cross of Kansas on the Medicare Advantage side to Thrive and Prudential will be using it on the long-term care insurance side. We work with some of the big players in the Medicare supplement area. So we're getting good traction on that area. We don't talk specifically about the number, but we're in the tens of thousands of kind of caregivers that we're supporting kind of on a regular basis. And that number is growing. And the other part is the digital component has allowed us to reach a lot more people, not only within an organization. And we're very proud of the fact that we're getting, in any employer, we're getting 7 to 8% of all employees who are using Homethrive, so we're able to help a lot of people, and that's 2 to 3 times their normal utilization. We're doing something very similar on the health plan side, but it's also given us access to large groups of people that a high service component by itself would make very difficult and very expensive. And so we're able to bring a lot of support to people in a meaningful way beyond what they could get through Google or some of the other kind of services that are available to them. So we're really trying to work to expand that as much as possible in a meaningful way.
Amazing. What are some of the biggest challenges the company faces today?
There's certainly no shortage of challenges. I think that one is to educate the market about the need for family caregiver support. We think we do a really good job with it, but I would encourage any employer or health plan who's thinking about this, that if they're not going to use Homethrive, they should use somebody, because family caregivers, people spend on average 20 hours a week doing stuff for their aging. And it takes a tremendous toll on them. The level of stress that, the 50% more likely to have substance abuse issue or to be obese. They're not following a lot more chronic conditions as a result. And so their own health and well-being deteriorates, as well as productivity. And as you may know, 1 in 3 caregivers will leave their job for a period of time to take care of kind of their parents. They just got to figure things out. And we really don't think that this should be contributing to the Great Resignation at all. We think people can be there for their parents and kind of be there for their career. So but that takes time to make sure people are aware of this and come to understand it. So we're doing a lot. That's one of the biggest challenges that we face kind of in the process. And the other is there's a lot of noise and a lot of clutter with a lot of digital health solutions, a lot of point solutions, and being able to find ways to do that or work with people. We're doing some things on mental health. We're actually starting to do some things on fertility so that we can and we're doing more on childcare to be able to bring a more holistic solution to employees so that more people are aware and have access to a lot of the great benefits that their employers offering them or their parents' health plan.
Incredible. If everything goes well, what's the long-term vision for Homethrive?
We really want to be able to serve over 1 million people in this caregiver world, if not more, and really be able to cover the full gamut of family caregiving support. And whether that's continuing as an independent company or as a partner with somebody else, I guess that'll remain to be seen, and others will be involved in that decision. But my hope is that family caregiver support in 5 years looks a lot like mental health looks today, where seven,
Okay.
8 years ago, it was a niche kind of benefit that wasn't widely offered with employers or health plans. And now it's a very mainstream program, which it should be. 85% plus of all employers offer something. Most health plans offer something. And my goal is that family caregiver support has that kind of adoption. And hopefully Homethrive, we want to leaders, but at the very least, we want this to be a program and a service
Yeah,
that's available to a lot of people. And we want to be a big part of providing it.
I love that. I always like to ask this question, one for selfish research, but also for my audience as well. Whether it was early in your career or even currently now, what books or people have influenced you the most?
Um, there's a couple of things. I think one thing I read a lot, I've gotten kind of to be a fan of, is the Stoic philosophy. So somebody like
Cool.
Ryan Holiday, who's popularized it, and whether his book kind of Discipline is Destiny or Courage is Calling, some of those things I find very helpful because it it's a very empowering kind of approach. And so I find it kind of interesting, and the historical kind of significance I find interesting. A book that I enjoyed, I read pretty recently, kind of along these lines, is it's called 30 Days with a Navy SEAL. And
Mm.
it was written by Jesse Itzler, and he had a Navy SEAL who was with him. But he said, I'll live with you only if you do everything I say. And it was a lot around pushing boundaries, more mental than physical. And it turns out that Navy SEAL was a guy named David Goggins, who since then has become very popular in his own right, but they never mention his name throughout the book. But that idea of being able to kind of push yourself and recognizing what boundaries, somewhat artificial, you put up yourself, and being able to push through those things, I find very interesting and empowering.
Incredible. Well, then, Dave, I hope you enjoyed yourself on the show. I'm always excited to chat with founders from different backgrounds and experiences, and dive into not only their industry expertise, but also their newfound expertise in building companies and what it's taken to really grow something and scale something to a degree that they feel an impact. And I love your story. I love what you're building, and I'm excited to see it come to fruition with the different products and offerings you have. But last little bit, I always give time for my guests to give us your plugs. Let us know where we can find you, where we can visit and support the mission, or if I'm a family caregiver, where I can use the product. Give us your LinkedIn's, your Twitters, your websites, where are you at in the App Store. Give us all that.
Yeah, I mean, the best place would be kind of homethrive.com, and to talk about kind of the family caregiving challenge that's out there, the need, but also the ways in which we can support them. If somebody, we sell kind of through employers and through health plans. We don't do kind of a direct to consumer. People can sign up individually, and we'd be happy to be able to support them in whatever they need, whether it's a digital format. And then usually a few times a year when people have a more intense situation, and then we're on LinkedIn and whatnot. And we just are really passionate about that family caregiver support area and want to do more to be able to have more individuals with access to a service like ours.
Incredible. Again, I hope you enjoyed yourself, Dave, and thank you so much for being on the podcast.
Yeah. No, thank you, Julian. This was great. You obviously understand the founder's challenge and kind of some of the dynamics through the question. So it's really interesting to talk to you about it.
Amazing. Well, we'll chat again sometime soon. Take care.
Thank you.
Dave, I hope you enjoyed yourself, man. Thank you so much. Oh,
Yeah, very much.
yeah.
These are, it's funny.